Restrictive or liberal red cell transfusion for cardiac surgery. Definition: the effect of restrictive versus liberal red cell transfusion strategy on clinical outcomes in patients undergoing cardiac surgery remains unclear. The avoidance of unnecessary blood transfusion is a high priority. Therefore, determining safe thresholds for transfusion is imperative. Among the highest recipients of red cell transfusion are patients undergoing cardiac surgery, with a substantial proportion of the total blood supply used by this group. Whether a restrictive approach to intraoperative and postoperative transfusion in cardiac surgery safely achieve outcomes similar to those achieved by means of a more liberal approach remains unclear.
What investigators did in this is they randomly assigned patients who were undergoing any cardiac surgery, it was about equal bypass and valve surgery, to either a restrictive threshold, that means no transfusion unless the hemoglobin dropped to less than 7.5, or a more liberal transfusion, that meant hemoglobin of less than 9.5 during the surgery or less than 8.5 subsequently in the intensive care unit or on the wards. The primary outcome of this trial was death or dialysis out to either hospital discharge or 28 days. So a robust outcome being assessed. And in fact, what
Applications in medicine. Clinicians have been adopting restrictive transfusion strategies in cardiac surgery with increasing frequency, largely on the basis of the known risks of blood transfusions and of observational studies linking transfusion with increased mortality and major morbidity.
Patients like Harriet White do better overall. Memorial dramatically reduced the percentage of heart surgery patients getting transfusions from 59% in 2006 to 19% in 2011. The benefits are significant.
The people who get a blood transfusion in general do more poorly, and they have a higher risk of death, they have a higher risk of infection.
As a result, Dr. Brooker says patients like Harriet White do better overall, and blood can be saved for those who really need it. I'm Marty Salt reporting.
Pros and cons. Pros: more effective and safe surgery, decreased death and major disability. Cons: infections and non-infection risks associated with transfusion. Patients who are at high preoperative risk might be more susceptible for anemia-induced tissue hypoxia.
Type and immunological responses. The most common type of these is type O, which is also the rarest. Between 3 and 7% of most populations donate blood, and considering type O can make up a very small proportion of this is a limited pool that is subject to seasonal and event effects such as influenza and public holidays. Being able to both supplement, if not replace donation via a synthetic process is something of a holy grail. It would be used to smooth out the demand and supply issues of blood donations. An example of the need for this is the events in Florida, United States of America, in which after a mass shooting, there was a depletion of blood supplies across the state.
In Ecuador, the figure reaches 1.42% according to the Ministry of Public Health until 2013. A year before, the percentage was 1.41% of the 13 million Ecuadorians according to the data published by the INC.
For instance, last year issued their Choosing Wisely guidelines. And their first guideline was transfuse only as little as you need to maintain an acceptable hemoglobin, 7 to 9 grams, to help to minimize symptoms or overcome symptoms of anemia. And I perceive that there has been pushback about transfusing patients nationally. In some ways, that's an application of intensive care or critical surgery, randomized studies on how to run a hemoglobin when to transfuse to an outpatient ambulatory population that hasn't been validated. That's my opinion, not a fact. But But I wondered what you thought about that, about the evolving role of transfusion and about the national trend in transfusion and how that influences your practice.
Yes. So 2 points here. One is the European guideline actually is that individuals over the age of 70 with lower risk MDS
Conclusion: in patients undergoing cardiac surgery who were at moderate to high risk for death, a restrictive strategy regarding red cell transfusion was non-inferior to a liberal strategy with respect to the composite outcome of death from any cause, myocardial infarction, stroke, or new-onset renal failure with dialysis with less blood transfusion. Thank you. Yeah.